All right, looking good. Thank you all for joining us today for the American Heart Association's Metabolic Syndrome Educational Webinar featuring Dr. Robert Groves and brought to you by Banner Aetna. My name is Corinne Kleinschmidt, and I am the Vice President of Health for the Greater Phoenix American Heart Association, and I'm very excited to bring this digital experience to you via Zoom today. Before we get started, and as some folks are continuing to log on, I do want to just cover a few housekeeping things. First, as you noticed when you logged on, we are recording this session, and that's to make it available afterwards. So at the very end, you will receive an email with a copy of the presentation slides and then a link to the recording. So you can take notes during the presentation, but if you do find you missed something, you will have access to this recording and the slides after the webinar. Also, live captions are turned on automatically for attendees. So if you want to experience today's event without the captions, all you have to do is click Live Transcript button on the bottom of the Zoom toolbar, and you can select Hide Subtitle. For those not as familiar with Zoom, we'll take a moment to go over some tips to help you enjoy the session better. The first is to change your view of the speakers and the slides. You click the word View in the top right corner of your Zoom screen. There will be several options for the View menu, so you can click on each one of those to see which one you like the best. Next, we want to make sure you know how to ask questions and to make comments. So when you joined the webinar, you were given the main event window. You can add the chat window added to your view. The slide here shows a picture of what that looks like. If you want to remove the chat window, you click Chat again, and it will come down. You can also move the chat window around on your screen if it's blocking something, just by grabbing it at the top and dragging it with your mouse. When you have the chat window open, you can type in your responses and any questions you might have. And we ask you to choose to message everyone so that the messages go to all attendees. You can also choose just to send to myself or the presenters if you need direct assistance, but we do encourage you for any comments or questions to select everyone so we can better help you. So let's test what we've learned. Open your chat box and type in the answer to this question. True or false, metabolic syndrome can lead to heart disease? Wow, you guys are nailing it. It's true. It is true. It's unfortunate, but it is true. And someone else had mentioned, asked if they were maybe muted. Everyone who came onto the call is automatically muted, so you don't have to worry about that. Well, congratulations, you guys. You got it. Yes, unfortunately, metabolic syndrome can lead to heart disease. Now, as we get started, I do want to give special thanks to our sponsor, Banner Aetna, for making this event possible. We're excited to work with them and to provide this invaluable information about metabolic syndrome and how to reduce our risk. Banner Aetna is an Arizona health insurance company that leverages the strengths of two of the largest healthcare organizations in Arizona, and that's Banner Health and Aetna. So thank you, Banner Aetna, for your support. Today, I want to welcome Dr. Robert Groves, the Executive Vice President and Chief Medical Officer for Banner Aetna. In his current role, Dr. Groves is responsible for population health management. He received his MD from the Medical College of Georgia and previously served as the Chief Medical Officer for the Banner Health Network. Today, he will explain what metabolic syndrome is, who's at risk, and what you can start doing today to help improve your overall cardiovascular health and the conditions that make up metabolic syndrome. Dr. Groves, thanks for coming today.
Thanks, Corinne, and welcome everybody. Good morning. I have designed this presentation to be available to everyone, so you'll have time to ask questions after we are done. But I'm sure that metabolic syndrome is a term that everyone has heard. And what we're going to do today, as we go to our next slide, is look at what is metabolic syndrome. So we'll give you a brief definition of what that means, also called Syndrome X. Why does it matter if you have metabolic syndrome? What are the risk factors for metabolic syndrome? What kind of symptoms might one have? And how can we prevent and treat this syndrome, this disease? So what is metabolic syndrome? It's a group of 5 risk factors, actually. So when you hear the word syndrome, often causality is multifactorial. In other words, there are a number of things that can lead to the syndrome. And it's not simply one thing, but it's a group of 5 risk factors that can lead to heart disease, diabetes, stroke, and other health problems. And let's talk about that. So how do we diagnose it? Well, you have to have 3 or more of the following conditions. First of all, a fasting high blood sugar or a high glucose. And sometimes on your yearly exam, your physician will order a fasting glucose. If that level is over 100, then there's a concern that you might have metabolic syndrome. The other way to test for glucose intolerance is a hemoglobin A1C, and you've probably heard that term before. The second feature is low levels of high density lipoprotein. You've also heard that referred to as the good cholesterol in the blood, the one that helps clean up the arteries, if you will. Often those levels are low in metabolic syndrome. And then we have high levels of triglycerides in the blood. Another one of those lipids, if you will, on the panel of lipids that's often checked. And when the triglycerides are high, that's a marker that you're storing fat in your liver and in your pancreas. And that fat is metabolically active and leads to lots of trouble down the road. The other factor is what's called an apple-shaped body. And it's characterized by a large waist circumference. And we'll give you some specifics on that in just a minute. And then a topic that we've covered pretty extensively before, high blood pressure. So if you have any 3 of those 5 indicators, then that is, in fact, metabolic syndrome. All right, let's go on. So I'm going to ask the audience, what percentage of US adults have metabolic syndrome? Encourage you to go to the chat box and enter your response.
I'd say the answers are coming furiously. A lot of folks are saying C and D.
Still coming through there. Looks like it's tapering off a little bit, and there's your answer. Over 34% of US adults have metabolic syndrome. And very often these same patients have what's called pre-diabetes. And before we move on to the next slide, I want to comment a little bit about that. Pre-diabetes means that you haven't met the diagnostic criteria for full-on diabetes. And it's usually measured by the hemoglobin A1C. Depending on the lab, if you're over a certain level, usually around 6.5 or so, then that qualifies you for diabetes. If you're somewhere between 5.6 and 6.5, that's pre-diabetes, but it's an indicator of insulin resistance. And as you might imagine, dramatically increases the risk that will evolve to full-on diabetes over the next several years. So it is a marker for a metabolic derangement that is toxic to the body. And next slide, please. Now, why does this matter? It matters because metabolic syndrome alone is a risk factor for cardiovascular disease, for diabetes. When you compare with folks who don't have metabolic syndrome or syndrome X or insulin resistance, if you prefer, there's a much greater chance that folks with this syndrome will in fact develop consequences of this metabolic derangement. And that happens in the heart and with diabetes, which can obviously lead to all kinds of problems, including the liver, the heart, the eyes, the limbs, etc. So we'll talk about some of those increased risks. We know, for example, that coronary heart disease and heart attack. We've done a program on that some time ago. We're going to make sure that you get the links to that if you want to go back and get a refresher on that. But it's when the arteries that supply blood to the heart muscle itself become narrowed or blocked by fatty deposits, often called plaque. And the amount of blood and oxygen reaching the heart is diminished, and that can cause low blood flow to that heart muscle, resulting in pain called ischemic pain, or it can actually kill portions of the heart muscle, and that's when you have a full-on heart attack. Diabetes occurs when the body can't make enough insulin or is unable to use insulin properly, decreased insulin sensitivity. And what that means is even though the body is putting out insulin, the cells in the liver and muscle and elsewhere in the body don't get a strong enough signal to get that glucose into the cell and dispose of it. And so it circulates in the blood where it can cause all sorts of problems. It increases the risk for kidney failure, cardiovascular disease, as I mentioned earlier, liver disease. There's something called NAFLD, or non-alcoholic fatty liver disease. And that's when those fat deposits increase in the liver. And it is predicted that within the next 5 to 10 years, that will be the #1 reason for liver transplantation. And you saw earlier that over a third of folks already have metabolic syndrome in this country, and it really is rising at an alarming rate. And it's because of metabolic syndrome, prediabetes, diabetes, and obesity that the risk of these things keeps going up. It really is an epidemic of metabolic disease. So, as you might imagine, the risk factors for developing metabolic syndrome, essentially the stuff that we've already gone over: obesity or being overweight, insulin resistance that we've already described. Men are at much higher risk. And as you age, your risk increases. And there are some racial differences, not as strongly contributory, however, as gender and age. Go ahead. So what kind of symptoms might you have if you have metabolic syndrome? Well, it's asymptomatic in most folks. They don't recognize necessarily that they have it unless they've heard of it and investigated some of the markers for metabolic syndrome. So there's no one thing that will tell you that you have it. But if you're overweight and apple-shaped, it's a pretty, and if you have hypertension, it's a pretty good idea to get checked for metabolic syndrome. Let's go on. Okay, which of these increases your risk of having the metabolic syndrome? And you can just put that in the chat box.
They're coming in fast and furious. A lot of folks are saying E, a few are saying C.
I think the folks that are saying E have a sense of humor. Oh, no, I'm sorry. D is the one that I haven't seen come up. And I always look for that person with the sense of humor. It is decidedly not having freckles. And those of you who picked E got it right. All three of those prior lists could lead to metabolic syndrome. How's it diagnosed? Well, it's pretty straightforward. If you have abdominal obesity, if you have high triglycerides, low HDL cholesterol, high blood pressure, or a high fasting glucose, and remember, 3 out of 5 gives you the metabolic syndrome. And next slide. So how do we measure central or abdominal obesity? It's pretty straightforward. In men, it's a waist of greater than 40 inches, and in women, that's about 35. Those two numbers correlate pretty well with the risk of metabolic syndrome identified by the other markers. Okay. Cholesterol. Now, we talked about cholesterol when we had the discussion on heart disease. And the two issues here are a decrease in HDL and an increase in triglycerides. Cholesterol normally circulates in the blood. That's not the concerning part. But if you have high triglycerides over about 150 milligrams per deciliter, and check your lab values, sometimes they'll be reported in different numbers. And so make sure that you're talking the same numbers when you look at your triglycerides. You can take medication for that, and there are also some dietary changes that can help. Same thing is true of low HDL cholesterol. And in men, that translates to less than 40. In women, it's less than 50. All right. As we mentioned, high triglycerides plus low HDL, often that it leads to an increased LDL and increased risk. And I think we have a short video here. Is that right, Corinne?
Cholesterol. It's essential to your well-being. But what do you really know about it? Let's start with the basics. What exactly is cholesterol? Well, it's a waxy, fat-like substance that's made in your liver and travels throughout your bloodstream. It's a key ingredient that your body needs to make new cells. But too much cholesterol can lead to serious problems, such as heart disease and stroke. Here's why. You see, there are actually two main types of cholesterol, LDL and HDL. LDL, or low-density lipoprotein, is sometimes called bad cholesterol because it can build up inside your arteries, which causes them to narrow, which can lead to heart disease or stroke. That's why you should try to keep your LDL low. Think of it this way. The L in LDL is for lower or lousy. On the other hand, HDL, or high-density lipoprotein, is the good kind of cholesterol. It carries LDL, the bad stuff, away from your arteries and back to your liver, where it's broken down and processed by your body. That's why you want your HDL to be higher. In this case, the H in HDL is for higher or healthy. There's actually a third component known as triglycerides, which plays a role in your cholesterol health. Triglycerides are the most common type of fat in your body, and their job is to store excess fat from your diet. Elevated triglycerides, along with low HDL and high LDL, can also increase your risk for cardiovascular disease, so it's important to keep your triglyceride levels low. For anyone who's had their cholesterol checked, it's only natural to focus on your cholesterol score, or the actual numbers. But the numbers don't really tell the whole story about your health. That's why it's important to discuss all of your risk factors with your healthcare provider, including risk factors that you can change, like eating a healthy diet, getting plenty of physical activity, and quitting smoking. Controlling your cholesterol may be easier than you think, but it all starts with getting your cholesterol checked. It's a quick and easy test. So if you're due to have your levels checked, or if you never had them checked, make it a priority. Taking the next step in managing your health is as easy as CCC. Check, change, and control your cholesterol. Get started now by visiting heart.org/cholesterol.
Now, obviously, that's pretty basic information on cholesterol, and we are much more sophisticated today and can break that down even further to assess cardiac risk. And so it is important, if you get a cholesterol study, to talk with your physician before you make any decisions about what to do or not to do, because there are some caveats, some special circumstances that you may not be aware of that can influence how much of a risk factor any of those numbers are in any one individual. The next piece is high blood pressure. And again, we've had a session on this. And so if you want a refresher, you can go back and look at that. We'll make sure that we get the links out to all of those of you who are attending. But high blood pressure is when you're literally the pressure required to force blood through the blood vessels in your body is consistently higher than it ought to be. What does that mean? Well, for metabolic syndrome, if it's over 130/85, or you have to take medication to keep it in that range, then that qualifies as hypertension or high blood pressure. Again, one of the 5 risk factors, if you will, one of the 5 diagnostic criteria for metabolic syndrome. And next slide.
Get it, slip it, cuff it, check it. Talk to doctor now and share it. Get it, slip it, cuff it, check it. Talk to doctor now and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
That is more fun than I usually have checking blood pressure. But the point here is that hypertension is often called the silent killer or one of the silent killers. And the reason that's so is because most people in this country who have high blood pressure aren't aware of it by symptoms. In other words, there's not any way you're going to feel different for the most part in most patients. And so it's important to check that number. The nice thing is there are lots of devices out now that you can pick up even at a local drugstore. I do recommend the arm cuff because it's much more difficult to get reliable readings on a wrist or an ankle cuff. And so using an arm cuff that's of the appropriate size, you can monitor this yourself and keep track of what your blood pressure is doing. And it's important to do that. Again, one of the signs and one of the diagnostic criteria for metabolic syndrome. Now let's talk about high fasting glucose. We said some about that already, but your digestive system obviously is designed to break down food and to turn those nutrients into the body's cells. So rebuilding, building, and that has to be transported in the bloodstream. Glucose is one of the major fuels used to drive metabolism. Insulin helps regulate the level of glucose in the blood and helps cells take up glucose to be used as a fuel for metabolism. It's produced in the pancreas. And remember earlier I said those high triglycerides can increase fat storage in the pancreas. That may be one of the reasons that we start to see insulin resistance and in severe diabetes, a decrease in the capability of the pancreas to even produce insulin out of the beta cells. A high fasting glucose is 100 milligrams or more, or if you're taking a medication to keep it in that range, you also have a high glucose. The one caveat here is that if you get tested for metabolic syndrome, there are 2 reasons it's going to be fasting. One is that's the best way to get a consistent measure of triglycerides, and the second is right here. Fasting glucose is the basis upon which insulin resistance is measured. And when I say insulin resistance, you can think your glucose is too high. It's over 100 in a fasting state, which indicates that there's metabolic disease present. And this, like the others, is one of the diagnostic criteria and one of the signs of metabolic syndrome. So you can probably guess what the major controllable risk factors are for metabolic syndrome. Get your blood pressure under control and keep it there. Keep your sugar in check with medications or diet if you can. Control cholesterol. You want the triglycerides down, the LDL down, and the HDL up. Maintain a healthy weight and eat a heart-healthy diet. Physical activity is one of those things that's almost like magic, and it doesn't take a lot. Even a daily 30-minute brisk walk can do wonders to improve insulin sensitivity, to help with weight management, and frankly, to help with depression and anxiety and many other symptoms. all of this should be discussed, obviously, with your personal physician and your personal healthcare team to make sure that the prescription for addressing these risk factors is specifically designed for you. And that includes physical activity, it includes the specifics of diet, and it may include specific medications for controlling other markers. So how do we treat it? Well, you just went through that with me. It's basically you eat better, you get active, get some exercise, lose weight, and work with your healthcare team to accomplish all of those. If you require medication, then make sure that you take it regularly and that you stay in touch with your healthcare team to make sure the dose is appropriate for you. And by the way, if you have metabolic syndrome, prediabetes, or diabetes, you aren't committed to it for life. There are strategies that can help you manage and even reverse some of those adverse trends. So talk to your doctor about what options might be available for you specifically to address metabolic syndrome. Now, the American Heart Association likes to talk about Life's Simple Seven, and it really is a simple seven that influences longevity as much as anything else you'll do. And it treats several conditions. There's a link to My Life Check that provides a scoring tool, key heart healthy targets for improving the quality and length of your life. I can break it down even further and talk about the big four. Now, we are ignoring some of the nuance here, but it's really how much do you exercise? How do you move? What do you eat? What do you put in your body? How well do you sleep? Critically important for glucose control and many other stressors. And then the fourth is managing stress. It is really fascinating to watch. I've been monitoring my own glucose. If I'm highly stressed, that adds 20 to 30 points to my glucose. It really does make a difference. So addressing those four is a great start. Work with your healthcare team to find out what other options might be available to help you manage your condition. Reducing blood sugar, there's a lot of information and a lot of hype about a lot of strategies for reducing blood sugar. We know medication works. We also know that in the absence of some significant lifestyle changes, that the progression of elevated blood sugar tends to move towards getting worse. And that's, of course, true with diabetes. It is, without significant lifestyle intervention, a chronic progressive disease. The good news is, with effective lifestyle intervention, it is a process that can be reversed and managed to the point that some patients are even able to get off of medication even after they have started. So it's worth talking to your doctor about all of the options that are available to address this issue. And this is a list of resources that'll be available to you if you want to learn more about metabolic syndrome, if you want to assess your risk and get a heart score, or if you want to learn more about managing your blood pressure and monitoring your blood pressure. The other thing that I would tell you is that I mentioned earlier, when you're measuring blood lipids, there's a quick and dirty way to look at it that we showed you on that short little video. But there's nuance there. And so talking with your healthcare team about those nuances can tailor your specific lifestyle and medication prescription to your needs. The same thing is true of an elevated blood sugar. No one size fits all here. A treatment plan, the strategy really needs to be individualized to each patient. And those services are available. There are a tremendous amount of resources that you can take advantage of through Banner Aetna, through the American Heart Association. So I encourage you to find out everything that's available to you, most of it free of charge, that can help you get control of this disease and live a longer and happier life. And with that, I believe I will open it up to questions, Corinne.
Yes, I was saying thank you so much, Dr. Groves. Really appreciate you sharing this information. And on behalf of Banner Aetna and American Heart Association, I hope everyone found today's session beneficial. We've had lots of questions coming in, some people answering each other's questions, which has been really nice to see as well. So we'll start with some questions submitted during the presentation. And then if you have more questions, please continue typing them in the chat box and we will get to as many as we can today. Our first was an observation that 1 in 3 adults having metabolic syndrome is very high. And that is just shocking and great information to have. And that, you know, you did mention there is greater risk based on gender and age group, you know, and you said it was men at greater risk and then as we get older, correct?
Correct. Yeah. But the bottom line is it can affect anybody. And the metabolic syndrome is a good tool as a marker for what might be going on underneath the metabolic derangements that are present. But I would also caution you that one can have prediabetes and glucose intolerance or insulin resistance with a normal body habitus. In other words, you can look completely normal and have a normal BMI and still have this. So when we say that 1 in 3 has metabolic syndrome, it's actually a little worse than that if you look at prediabetes plus metabolic syndrome, because of those folks that may be relatively lean and yet have insulin resistance. There's a lot of debate about what causes it, and we can go into some of that detail if there's interest, but it is a complex area that has been researched and debated for years.
Yeah, I was going to say that's definitely disheartening to hear that it's even worse, but you know, it goes back to the reason we have this is so that we can learn, and the more we know, the more we can then take action. You'd mentioned also that for waist circumference, that is one of the ways to look at that. Talking about was different for men versus women, and we had several people commenting that they liked that better than a BMI, that they feel like this might be a more accurate way of determining. And so just wanted to mention that as one of the comments people were submitting.
That's a great point, and let me add to that just a little bit. BMI, or body mass index, is a really good tool for looking at large populations and trends over time. But a BMI, particularly when it's in the 25 to 30 range, in other words, just over what's considered normal, that doesn't tell you what body composition is. And the questioner is absolutely right. Somebody that's heavily muscled can have a high BMI, but be metabolically healthy. Similarly, there are those with a normal BMI, as we mentioned earlier, who may not be metabolically healthy. So it's really a best tool for population management and not down to the individual. There are lots of things that can be done to look at actual body composition in individual people, and those are much better measurements. But you're right, waist circumference can be a very quick and useful tool to determine if you have one of the signs and or diagnostic criteria for metabolic syndrome.
Yeah, I was saying current comments are like, well, BMI, I thought that was a metric that was falling out of favor. And to your point, it goes back to, it is good for population and understanding large numbers and getting general information about a population, but for your own specific self and what you specifically need, waist circumference can help a lot.
Yeah, and the reasons for the increase in BMI over time are highly complex. Some of it may have to do with policy and the amount of sugar that we take in, but it's also fair to say that BMI has been increasing actually since the 1700s. Maybe it's because as we've gotten more sedentary, maybe it's because of genetics alone. There are lots of factors that feed into this. So BMI has been gradually increasing over time. The other thing that I would point out is that mortality increases at both ends of the BMI curve. And so that it's sort of a U shape. In the middle there is the lowest mortality. But if you get down below about 18, mortality starts to go up. You can be too lean, just like you can be too heavy. So, you know, it's trying to thread that needle. The other fascinating thing to me is the data is pretty clear that the sweet spot, in other words, the bottom of that U curve, goes up over time with age. And so it's not as toxic to have a BMI of 27 or 28 at 70 as it is in a younger person. So fascinating insights that we've.
Yeah, that's excellent. There have been a lot of questions talking about diet and what kinds of diets are best when it comes to metabolic syndrome. And so to kind of put it all together, there's a lot of questions about keto and what diet is the best. And, what are your thoughts on keto? For some folks, if they've been posting that it's been working and it's helping, and others have said it has not been working and not been helping. So when it comes to diet and nutrition, what do you recommend when it comes to metabolic syndrome?
Yeah, that is a charged subject, a very controversial one in the literature. I think what is clear is that for a significant number of those who are diabetic, full on insulin, or not necessarily insulin, but on blood lowering medication, blood sugar lowering medication, a low carbohydrate diet can be very effective. Now, I would encourage all of you not to try this, particularly if you're diabetic, on your own, because what can happen is the blood sugar can bottom out and you can become hypoglycemic. The second thing that can happen is eating the wrong kinds of foods. Even though it may be low carb, it's not a well-designed diet. So it's not a healthy diet, if you will. And then the third caveat for very low carbohydrate diets is that there are some people they simply don't work for, either because they're intolerable or because in a certain subset of patients, it drives up some of those cardiac risk factors. Now, the good news is that we now have at least 2 years of data showing that the cardiac risk factors in populations do not go up. There are changes in lipid levels, but population cardiac risk is either stable or goes down. And that's been documented by more sophisticated measures of lipids that I mentioned earlier, as well as carotid ultrasound showing no worsening of plaque buildup in the vessels over time. We're waiting now on 5-year data from a cohort study, so it's not randomized, but there are randomized controls underway, particularly in Europe, that will give us a lot more information about this strategy. Having said all that, we have some experience in Banner-Aetna with populations using a very low carbohydrate diet. And for some folks, it's magic. For others, it doesn't work as well. But it's not the only way to get there either. And so there is no one size fits all. You're all familiar, I'm sure, or have heard the name Dean Ornish. He has a strategy that's very low fat, primarily vegetable diet. And those two can be highly effective in both lowering cholesterol and lowering overall cardiac risk. Tend to be more challenging in a population that has full-on diabetes unless low carbohydrate strategies are engaged as well. I hope that begins to answer some of those questions.
I say it definitely does. And like you said, it is very personal to folks, and the number one recommendation of working with your doctor, your medical provider with that, because everyone's bodies are different. And so, what works for one may not work for another, but being able to work with your doctor for what is right for you.
Yeah, and I want to emphasize again, particularly for diabetics, instituting very low carbohydrate diets on your own is a very bad idea. That's something you need the supervision of a physician or a healthcare team to manage, often being in touch with that team multiple times a day, because glucose levels can start to drop significantly when one reduces the amount of starch and carbohydrates in the diet.
Okay. We had some folks asking about home blood pressure monitors and if that was something covered by HSAs and FSAs. And I was going to say, yes, they definitely are. It depends on which HSA or insurance you have. Some of them do have restrictions on the models that you can use and get, as far as making sure they're a validated cuff and things like that. Charisse had said that Hello Heart has a benefit with the Virgin Pulse program. It looks like a lot of folks have that. And they said that the BP cuff can be covered. And so you don't have to then actually pay for it. It's covered by the insurance. And so as AHA, it goes back to, you definitely should talk with your doctor and look at the benefits of your insurance, because a lot of insurance providers are covering monitors now, depending on what your diagnosis and readings might be in the doctor's office. So before you go and buy one, double check and see, because you might actually have it be covered completely.
Absolutely. And for example, folks that have never had a problem with blood pressure before, but maybe become high-risk pregnancies, moms, often get the use of a home monitor for blood pressure for free, because we're very interested in making sure that we keep that under control to protect mom and her baby in the gestation period.
Perfect. With blood pressure, they also ask, what is the best time of day to check your blood pressure if you're checking it at home?
My answer to that would be the same time of day. The real caveat to getting a good blood pressure measure is to not just dash in from the house or jump out of bed and immediately slap on a cuff and measure it. It really is important to sit for a good 5 minutes and relax, maybe do some breathing exercises, because you want to get a consistent value. If you're used to measuring it when you get up, then wait till you're awake a little bit, and then take that 5 minutes. You could do it when you get home at the end of the day, but shed some of that stress from the end of the day before you check it, because you'll get, our blood pressures vary a lot. With exercise, it'll go up. With stress, it'll go up. And so trying to find what is my blood pressure usually when I'm at rest is the key. And if you check it about the same time every day and you get that rest in before you actually check it, you'll come up with a more consistent number.
Yeah, definitely more consistent over time. We had Yudi asking about information available in Spanish, and I said, yes, we do have information in Spanish. Not always exactly the same as what this presentation is, but we have a lot of different infographics and things like that. So I'll make sure to send out some information, and Christine will be sending the email to everyone afterwards, and send a link to our heart.org website that has a portal of various resources available in Spanish too. Someone asked about reversing high blood pressure. Can you reverse it?
That is a great question. And the answer is, in some, if not many cases, yes. And it all gets back to the lifestyle changes that we talked about. The same things that tend to drive down blood sugar in those who are insulin resistant tend to reduce blood pressure in those who have hypertension. Now, there are forms of hypertension, essential, which is what we call it when we don't know the precise cause, and other that can't be reversed using these lifestyle strategies. So I don't want to give false hope, but for those who are mildly hypertensive, yes, absolutely, changes in lifestyle and your daily activities, those 4 things I talked about earlier. What do you eat? How much do you move? How well do you sleep? And how well do you manage stress? Those are factors, all of which can influence blood pressure.
Perfect. For timing again, for a fasting glucose reading, is it better to have it done in the morning compared to the afternoon, or any time is good?
Yeah, most people do it in the morning because typically we like to have a 12-hour fast. That can be more difficult for folks during the day. And that's the number that, is set, if you will. That's where it's been measured to determine what the cutoffs are. So that's the standard. I would say that there's something called, I think it's called dawning or sunrising, where there's a brief elevation of fasting blood sugar in the morning as your body gets ready for the day. So you can experiment a little bit with what time of the morning you check that fasting blood sugar. But if you're at the margin for any reason, that's a reason to pay attention.
Perfect. When it comes to cholesterol, are there other medications besides statins and they mentioned fenofibrates?
Yeah, there are lots of strategies that have been used to try to manage cholesterol over the year. over the years. And for example, some people respond really well if the elevations are mild to the addition of fiber. So there are fiber strategies that have been used. Niacin has been used. There are all sorts of options out there. The real issue is none of them has been as effective as those that are specifically targeted to lower cholesterol. However, it is always wise to consider lifestyle changes to try and either reduce the dose of that medication or potentially get off of it. We're learning more and more about statins and how they actually work. There's even some controversy now about whether the risk reduction is actually directly related to the cholesterol lowering effect versus an anti-inflammatory effect. And so it is not necessarily true that stopping the statin is a good idea, even if you've managed to lower the dose somewhat. And so this is something, again, that you'll want to talk with your specific physician who knows your background, knows what you're facing, to get an answer to that question for you.
We had some folks mentioning that they have been on Weight Watchers and they still have to take statins, or they're doing this other thing and they're still taking medications, and sometimes they're being then recommended to take additional things. Is it sometimes just genetics? I feel like some folks are feeling like no matter what they're doing, it's just not working. Is genetics out to get us sometimes?
There is no question that genetics plays a key role. Concordant twin studies, which is one of the best ways to measure this, and I'll call it an R value. And if you get it to 100%, then that's 1-to-1. If you have these genetics, you've got this problem. And it approaches 90%. So there's a huge genetic component, but that doesn't mean that there's nothing you can do about it. What it means is it's going to be harder for some people than others. And some people are going to need slightly different diets than others because of their genetic profile.
Yeah, and slightly different medications at different doses at different times.
Exactly. And we're learning more and more about this. There's no one, fat gene out there, but there's a genetic correlation. And as we learn more about the human genome, we're finding, like SGLT2s for obesity, for example, we're finding unique and novel strategies to address problems that have been haunting us for decades. And all of those are good. But I want to say, if you substitute that for the lifestyle changes that are going to be healthy for you, no matter what, then I think that's a mistake. I think all of us can benefit from being better at exercising, at eating, at sleeping, and at managing stress. There's just no question that those things make a big difference in, again, lifespan and longevity. Something that people often forget is that if you look at longevity and quality of life, all the $4 trillion that we spend on healthcare only accounts for about 20% of that benefit. About 30% roughly is genetics, and this won't add up to 100 because I'm guesstimating here. I think environment is a small amount. If you look at pollution, et cetera, at least in this country, around 10 or so percent. 30% is fully dependent on those personal behaviors. So those personal behaviors, those 4 that we talk about over and over, have more of an impact on quality of life and longevity than the almost $4 trillion that we spend on what we call healthcare.
Yeah, there's a lot to it. We've had some folks talk too about, besides our doctors, would it be better for nutrition help to talk to a dietitian or a diabetic educator for more detailed for one's condition?
Yeah, any place that you can get advice is good. My personal bias is that you need to understand as much as you can about your particular metabolism. Yes, talk to a dietitian. Yes, talk to diabetes educators, but get a second opinion and a third and a fourth, because finding that key strategy that works for you is a process. It is rare that somebody on their first visit talks to a dietitian and gets handed a magic key that's going to help them be healthier over time. It's your habits, your lifestyle, your challenges, and find somebody who's willing to talk to you about those or gives you the resources so that you can address those, because that's what makes the difference over the long term. It has to be sustainable.
Right. I was going to say that's so true. Making good, healthy changes that only last for a month doesn't end up helping improve those numbers in the long term. Someone asked too about, are there medications to help the syndrome itself? Because what we're hearing is that there's the 5 conditions and things you can do there. Is there anything that's like overall for the syndrome?
At this point, perhaps there are, but I am not familiar with any one drug that treats all of it. Now, if it's driven by diet, sometimes diet alone can address all of it. You know, your waist circumference, your blood pressure, your insulin sensitivity, and you eliminate triglycerides also. And so the only panacea, if you will, again, and I'm sorry guys, but it gets down to lifestyle.
Yeah. There have been some questions about people who have chemotherapy and cancer, and do they have an increased risk for metabolic syndrome?
That depends entirely on the cancer. And it depends. And by the way, manipulating diet in the setting of cancer should only be done in consultation with somebody who is really smart about the particular cancer that you have, the particular drugs that you're taking. For example, there have been at least some studies that suggest if you take massive doses of antioxidants, you're protecting the cancer cells from chemotherapy as much as you are protecting the cells in the body. So it's not something you want to just toy with or, you know, read the latest on, I don't know what the sites are these days that you can get that kind of information from everywhere, but be very careful and judicious about what advice you're getting and where you're getting it from. I also understand that many of us have been under the impression that sometimes physicians, because of the way that we are trained, get locked into this is the only way to do it. I'm not suggesting that that's true either. There are physicians who are more flexible, who are more interested in the edges of scientific knowledge, but understand that that's where you're practicing. And if it's worth it to get to the outcome that you want, you know, get those second and third opinions, but be very careful about what data backs up the strategy that you're investigating.
We have some folks who are concerned that after the pandemic and gaining some weight, that they might be on the verge of being pre-diabetic. They might be on the verge of metabolic syndrome. They're kind of asking about, you know, should they start monitoring their own glucose level at home? Should they be, you know, doing their own glucoses and trying to see besides just like the fasting ones with the doctor?
Yeah, you know, it certainly doesn't hurt to know where you stand, just like knowing where your blood pressure stands. If you've got, 2, 3, 4 markers of metabolic syndrome, then it probably makes sense to measure that blood sugar. But again, talk to your provider. They may be able to get you, a strategy that works for you without the cost of buying the strips and the meters and so forth. And sometimes all that it takes to put your mind at ease might be get a fasting blood sugar and it's down around 82 or it's 76. Then, you know, you can breathe a little bit of a sigh of relief. That's not licensed to eat whatever you want, whenever you want, but it does give you an indication that you're maybe okay for now. A word about the pandemic, that really was a triple whammy in that, there's high stress related to the uncertainty in the world today. There's challenges for those who used to go to a gym or used to get out a lot and walk, and they got shut down for an extended period of time. And then stress tends to make us eat worse and more. And so there are a number of things going on there that could have increased people's risk for metabolic syndrome, as well as many other chronic conditions. And so I think it's a great idea to reassess as we're hopefully coming out of that now. There's always the wild card, I suppose, but reassess and figure out what can I do to get me back to my baseline, to get me back to where I feel good about the activities I do every day, what I eat every day, and how I manage my stress.
Exactly. There's a question about your thoughts on athletic greens and Vita Hustle, talking about some superfoods and vitamin shakes.
Yeah, I don't know specifically about those particular items. I know that athletic greens has been popularized by Tim Ferriss. I don't know how many shows he goes without commenting on athletic greens, and I'm sure it's great stuff. But here's what I do know. It is always better to get nutrients from whole foods. The only exceptions to that are if you have a full evaluation by an expert and they identify specific deficiencies that it would benefit you to supplement. So, you know, if you're going to be traveling, you know your diet is going to be horrible for a few days, maybe it makes sense to supplement in situations like that. I certainly wouldn't argue against that. I don't know of any downside, but there's not a lot of data, a lot of solid data supporting strategies like that, except that when we've studied vitamins historically, and admittedly it's been one or two at a time to see if they improve outcomes, it's been a really mixed bag, and even some increased risk with specific vitamins like oh gosh, what was it? Vitamin A, for example, in lung cancer. Those studies didn't turn out so great. So be cautious and be judicious in your use of those. Do them only under supervision. Or if you know that it's just a temporary issue, that it's going to be challenging to get the nutrients you need for a few days because you're traveling, it's unfamiliar food, those sorts of things I'm okay with. Going beyond that, talk to somebody who knows what they're talking about.
Yeah, as I say, I've seen something that talked about that with some of those supplement shakes that they're high calorie, and then people were still eating their regular food. So it ended up being that they were increasing the amount of calories and things they were eating and finding that they were gaining weight, where it's like, well, you have to supplement and it has to be kind of like instant replacement, not as well as sometimes, but it's hard.
Yeah, and mind you, I'm not being critical as a blanket statement of supplementation. However, it has been my experience that a lot of times that supplementation is intended as a substitute for a healthy diet and healthy exercise. And we know that that's not the best strategy.
Right. Excellent. Well, as I say, thank you so much for today. We had one last question about Himalayan salt, which I can say that one as well. Salt of all salts has the same amount of salt. So when it goes back to lowering your blood pressure, it goes back to the amount and trying to reduce sodium intake. And the Himalayan salt tends to have nutrients in it, but that doesn't mean that it's good to have lots of it. It goes back to kind of that moderation in all things. So thank you so much, Dr. Groves, for today. As we conclude the session, I want to let you all know that you will receive an email afterward. We'll have a PDF and a link to the feedback survey. If you complete the survey, you are entered to win a $5 Starbucks gift card. We will have several winners, so your chances are very good. We would love to have feedback to let us know what you've learned and also how we can do better for our next session. So thank you again, everyone, and have a great afternoon.